My drug name is CETRORELIX.
And I am also a CETRORELIX.
And together, we will let you discover us.
I am available in brands such as Tetratype, Cetase, Relix.
My chemical name is CETRORELIX acetate.
I function as an infertility agent in the therapeutic classification.
My pharmacologic drug classification is gonadotropin-releasing hormone antagonist.
I am in category X in the pregnancy category. I am contraindicated to pregnant women because I may cause fetal abnormalities and any adverse reaction.
My mechanism of action is that it binds to the gonadotropin-releasing hormone receptor and acts as a potent inhibitor of gonadotropin secretion. It competes with the natural GnRH for binding to membrane receptors on pituitary cells and thus controls the release of luteinizing hormone and FSH or follicle-stimulating hormone in a dose-dependent manner.
I am rapidly absorbed following subcutaneous injection in which I am 85% bioavailable. And my timing of peak is about 1-2 hours after the administration. My volume of distribution is about 1 liter per kilogram, in which 86% is bound to the plasma. I am metabolized with the peptidases, and after the subcutaneous administration, small amount of me will be found in the bile over 24 hours. I am excreted via feces, in which 5 to 10% is unchanged and as metabolites in the bile. I am also excreted in the urine, in which 2 to 4% is unchanged. My terminal elimination half-life is about 30 hours.
My indication is for the inhibition of premature luteinizing hormone that surges in women undergoing controlled ovarian stimulation.
I am contraindicated to patients who are hypersensitive to me, the CETRORELIX acetate, as well as the extrinsic peptide hormone, mannitol, GnRH or the gonadotropin releasing hormone, and other GnRH analogs. I am contraindicated to women with known or suspected pregnancy or those who are in breastfeeding. I am also contraindicated to the postmenopausal women. I may cause moderate to severe renal and hepatic impairment.
My adverse effects that should be noted are the following. In the central nervous system, you might feel headache, while in the GI tract, nausea, vomiting, and abdominal pain. In the endocrine, an evidence of hot flashes, and in the skin, pruritus at injection site, and lastly, on the urogenital, ovarian enlargement, ovarian hyperstimulation syndrome, and pelvic pain.
Prior to the therapy of CETRORELIX acetate for injection, patients should be informed about the duration of the treatment and the monitoring procedures that will be required. The risk of a possible adverse reaction should also be discussed. If CETRORELIX is to be given to the patients for self-administration, information should be given to the patient's leaflet. Monitor routine blood chemistries through lab tests. Monitor weight and report development of edema and/or report shortness of breathing.
Preparing and self-administering Cetrotide 0.25 milligrams. Getting ready. Make sure you have all the necessary materials assembled in a clean area. 1 vial of Cetrotide 0.25 milligrams powder, pre-filled syringe of sterile water for injection USP, 1 pre-filled syringe, 1 yellow 20-gauge 1.5-inch mixing needle, 1 gray 27-gauge 3/4-inch injection needle, alcohol swabs, gauze, and a sharps container. Wash your hands with soap and water and make sure you are working on a clean, flat surface. Step 1. Mix. Using your thumb, flip off the protective plastic cap on the Cetrotide vial. Wipe the top of the vial with an alcohol swab. Remove the wrapping from the yellow mixing needle. Take the pre-filled syringe and remove the cover. Twist the yellow mixing needle on the syringe and remove the cover of the needle. With the vial on a flat surface, insert the needle of the pre-filled syringe straight down through the marked center circle of the rubber stopper of the vial. Slowly inject the water into the powder vial by pressing on the plunger. Swirl the vial gently. If bubbles appear, wait a few moments for the bubbles to settle. The liquid should be clear. Step 2. Preparing your injection. Keep the needle inside the vial as you lift the vial and turn it upside down with the needle pointing upward. Slowly pull back the plunger until the syringe fills with the total contents of the vial. Carefully remove the syringe needle from the vial. It is important to withdraw the entire contents of the vial. Recap the syringe needle. Detach the mixing needle from the syringe and lay down the syringe. Remove the wrapping from the gray injection needle. Twist the injection needle onto the syringe and remove the cover of the needle. Remove any bubbles by pointing the needle up and tapping on the syringe. Push the plunger carefully until a small drop of liquid begins to appear from the tip of the needle. Step 3. Inject. Choose an injection site in the lower abdominal area, preferably around the belly button, but at least 1 inch away. Choose a different injection site each day to minimize local irritation. Take an alcohol wipe and clean the skin at the injection site and allow it to air dry. Hold the syringe with one hand the way you would hold a pencil. Pinch the skin on the chosen injection site with the other hand. Insert the entire length of the needle into the skin at an upward angle of about 45 to 90 degrees, as indicated by your doctor or nurse. Release the hand pinching the skin and depress the plunger in a slow, steady motion until all the medication is injected. Gently withdraw the needle and apply pressure to the injection site by using a gauze pad. Step 4. Disposal. Discard the empty syringe and used needles in an FDA-cleared sharps disposal container right away after use. Do not throw away empty syringes or loose needles in your household trash.
The nursing responsibilities that should be done after mainly focuses on patient and family education. First, contact physician immediately for any of the following: abdominal or stomach pain, persistent or severe nausea, vomiting or diarrhea, decreased urination, pelvic pain, moderate to severe bloating, rapid weight gain, shortness of breath, or swelling of lower legs. Another thing is that understand that hot flashes are a common side effect of this drug. And lastly, do not breastfeed while using this drug without consulting physician.